Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you. And I want to thank everybody for calling in. That's I really appreciate that. You know, the show has grown in popularity. We get a little more comments about people that say they watch the show, and I appreciate those things. You really don't always know how people out there reviewing them, and so I know it takes a little bit of guts to pick up the phone and call in. You don't even have to use your real name. I don't even care. That doesn't matter. It's what your question is, what it is, and what's important to be answered. So anyway, anonymity is the key over here at the Independent Doctors of Pahrump. So we were talking about elevating the head of your bed, how important that is, and also helps to reduce pulling blood down out of your nose and mouth. It may help even sleep apnea. It may help a little bit of nasal congestion. So those are the things that might be very, very helpful for you. The other thing is obviously eating and what you drink. I would definitely, if you have this disease, I would not, this condition, I would definitely not eat late at night, and I would eat frequent small meals so that you don't have a lot of things. If you have a diabetes along with this, or if you have any condition that slows gastric emptying, that's going to make this more likely. So, and we're blessed to have Ray on the phone again. Ray.
Yeah, Doc, I got some questions on medical marijuana.
Okay, go ahead.
Now, most people think that smoking the marijuana is the only way to go, but I believe that kids are being treated with under the tongue. They get a gel under the tongue. I know some veterans have been treated topically with a gel that would go on the skin, and also something about eating it. Mm-hmm. The quandary is, what do you eat on the plant if you were to be eating it, and is it beneficial or as beneficial as the other alternatives? So if you can get into that a little bit, I'd appreciate it.
You bet. You bet. We'll talk a little bit about that.
Thank you very much.
You're welcome. So before we talk about the edibles and the other alternative forms of marijuana, let's just finish up the GERD thing. So eating frequent small meals, and again, staying away from carbonated beverages, spices, raw vegetables can be quite irritating to your stomach and gastric contents. So be careful of the raw veggies. They can be harder to digest. Alcohol is very irritating to the stomach, causes gastritis, especially if you mix it with a soda beverage. You get a little gas, and that causes more belching. Frequent, chewing your food extremely well so that the contents are easier to digest and move out of your stomach. And then if you're taking medication like we talked about for diabetes, that can do that. If you're taking opioids or pain medications, those will slow gastric emptying. I would tend to stay away from medications like, in rare things, medications that actually Reglan and drugs like that can increase, or they're called prokinetics. You can use them periodically if you have a really, really bad case, but understand that Reglan does deplete dopamine out of your system and can be an accelerant to Parkinson's disease. In rare cases, people have been on that particular drug and have developed Parkinson-like problems. So I think that will pretty much conclude that. I think weight loss is the key. I've talked about it a lot, about walking after you eat. Everybody's, oh, I got a big meal. Let me just sit back and relax and digest it. Well, that's the wrong thing to do. So get up and walk and help your body work off that food and get it out of your system as best you can. I don't think there's anything wrong waiting 15 to 20 minutes after you eat, but I wouldn't wait any longer than that. Okay, let's talk about the marijuana. The obviously not everybody smokes, and so people do get irritated if you have asthma or any type of allergies. Certainly inhaling marijuana smoke can be quite irritating to those tissues. And I don't think everybody's done a study of risk of cancer from smoking marijuana, but it isn't like cigarettes where you smoke 100 of them a day. And I don't think anybody, I shouldn't say that, can smoke as many cigarettes and marijuana as they do with that. They usually pass out after the first couple of them. But edibles, it takes a lot more marijuana to make edibles, and there are people that are good at taking oil and making butter, and basically you're taking the oil from the marijuana and you're mixing it into, you can use the raw leaf forms like oregano and other stuff of that nature to mix and stuff, but obviously oral works. Why does oral work? Because the government makes a form of marijuana called THC. It's not marijuana, it's the actual tetrahydrocannabinol product. It's basically, that's what it is, and so they put it in a pill form, and it is the purest form of THC, and if you've ever taken it by mouth, some people do really well with it. Some people have, side effects that claim it's very, very strong. So we know it does work, and that's basically the same process of taking that. I don't know if heat is one of those things. You may have to have an extractant. There are people that are understand the edible markets, and I don't understand it very well. And then certainly they've made, I had one lady that came to me, I was up in Washington and she was visiting, and she had a topical gel with marijuana and like a small little thing that probably in one of the dispensaries, and she was wiping that on some of her, in her arthritic joints, and was getting some pain relief with that. And so, and in reality, I mean, for you as a patient, it doesn't matter. If you have a condition that requires constant pain, it's up to your physician to determine whether or not that is a condition that can benefit with release. If you look at the instructions to the doctors from the state, it's really simple. I mean, it's just, does this patient have a chronic condition, a chronic debilitating condition? Now, they don't list they list seizures, but anxiety and some other problems. Does it impact your life, and does it impact your life in a negative way? And the answer is yes, and if it does, then you just have to so-called pull the trigger. You have to apply for the card, and you have to bring it in to me or a physician. I consider myself quite conservative in a lot of areas, but I'm quite liberal when it comes to the use of getting a medical marijuana card. The reason why is because I live the nightmare of what the pharmacies are doing to patients for pain medication, it's a war zone out there as far as I'm concerned with what they're doing to people. It's a criminal act, how they're making these people suffer for them being on chronic pain medications, often the so-called pseudo fear of the DEA coming in on them. But I think we've moved past that point. So if you do have a chronic pain condition, if you do have something that's chronically debilitating, and you've either experimented with marijuana or somebody has exposed you to that, and it seems to work with you, then that's fine. I mean, that's good enough for me. This is not me passing judgment on you. This is the state saying that as long as I'm a physician and I'm licensed to practice in the state, and you and I have had a meeting and we've discussed your condition, and I deem that yes, you might be getting help with it, and they're clear, they're saying mitigating. Will it mitigate your symptoms? Well, there's no guarantee that anything mitigates your symptoms. And if it does mitigate your symptoms and you do get some relief from it, then I'd encourage you to do it. I mean, once you get over this psychological barrier that they've placed in our mind of it being illegal and a felony and all this other crap that they've done for so many years, everything in moderation. I mean, I think if you get relief from it, this is your avenue you need to partake. And I think I don't promote the recreational use of marijuana. I don't think that is that just goes against my grain because of the. But if you're serving a purpose for pain relief, then you will use it for that purpose, and you don't use it for the purpose of basically doing something else. Now, insomnia and other problems like that, it might be a stretch, but it's certainly a debilitating issue, and that's a discussion that you have with your physician. So I may, and there's a list, and I got to do a little more research, and it might be something whenever the Grove does open up. I'm sure they're going to be more well versed in this condition because, in this instance, because they're running a business regarding that, and I'm pretty sure it's heavily regulated. As of today, the first of the year, I don't think it's open yet. And I don't know what the issues are, but I'm sure whatever it is, they'll eventually get worked out. There is one obviously open in Las Vegas, I believe, so if you do make that trip. And I do understand that until the Grove opens and you do apply for the card, you will be grandfathered in to be able to grow your own marijuana at your home. Obviously, once the Grove opens and you live within 35 miles of a dispensary, I don't think you'll be able to grow again. But hopefully when we get them on the show, we might find out what that actual rumor is. So for those who don't smoke, yes, edibles do use. There is a edible plant writer that you can get that allows you to grow more. And I'm sure most of the dispensaries at some point or another will be handling edibles in the form of oils and things of that nature. And so I encourage people to get into there should hopefully would be a self-help group within the marijuana community, those that are using medical marijuana, to help those people to explore. With that, it would be nice if somebody did start something like that so that those people that need to know how to make edibles can. And certainly, I have patients that are good at it. If you come to see me, I can give you their names, but I would never do that over the airways, so that you could contact them and they would be able to help you with that particular area of expertise. So, with that being said, I think it's time to, we'll be closing pretty quickly on the show. I hope to, one of the things this year is soon is getting that retired DEA agent on the phone and interviewing him and talking about this bogus crap that's being displayed at the pharmacies about the DEA putting pressure on the pharmacies to limiting your prescriptions. And that is absolutely one of the biggest falsehoods that exist today. The old pharmacies can order whatever they want. They just don't, because they don't want their numbers to go up, so the DEA can't come in and penalize them. That's the way they're going to handle this particular problem, and that is a shame, because that's forcing you, the pain patient, again, to miss your prescriptions or not do that. And I'm hoping that one of these days somebody takes some legal action against this form of abuse. With that, thank you for tuning in. We'll see you here same time, hopefully next Monday night. Thank you for tuning in.